Hi, folks. Christian Brindle here, president and founder of Christian Brindle Insurance Services, Medicare Health Plan Specialist, author of 3 books, host of the Everything Medicare Podcast, and Medicare advocate and expert. Today, we're going to be talking about what is Medicare Advantage. So you always hear about Medicare Advantage, Medicare Part C, all these different things. You see the TV commercials with Joe Namath and Mike Ditka and all these different TV commercials from various different insurance companies offering you $0 premium plans in the Medicare world. Now, what does it all mean? What does it mean? There's got to be a catch, right? Nothing can truly be free. Well, today we're going to unveil everything that has to be unveiled when it comes to Medicare Advantage, and we're going to show you exactly how it works, what it does, and what you can be expecting. So, does this look like you? So many people, when they first get onto Medicare, and even when they've been on Medicare for over a decade, are just terribly confused with all the different working parts. I've always joked, with clients of mine that the government has a vested interest in keeping us confused. They stay up late at night and try to think up ways to make it more confusing on purpose, because no sane organization would actually structure their healthcare system for seniors this way, but they do. So this is basically the way that it works with Medicare Advantage. You have Medicare Advantage can best be explained by running a person's Medicare through a private insurance company. So what this means is normally when you have Medicare Parts A and Part B, you are running your Medicare through Medicare, right? You have Medicare Part A, Medicare Part B, you pay your Medicare Part B premium, which is, as I speak to you about this, $144.60 a month. But instead of running your Medicare through the government and having them pay 80% of your bills and leaving behind 20% for you to pay, you can run your Medicare through a private insurance company. This new private insurance company comes through, they take the place of your Medicare, and they take on the risk. They take on the responsibility. And as you can imagine, that takes a big burden off of Medicare's shoulders, because Medicare no longer has to pay 80% of a person's medical bills any longer. This new private insurance company does. So in exchange, Medicare has determined that in a lot of situations it is more cost effective for them to just pay this insurance company a lump sum of money. I read an article earlier this year that stated that in 2020 they estimated a Medicare Advantage insurance company would make around an estimate of a little bit over $11,000 a year per person. So the insurance companies make hand over fist doing this. So obviously they would prefer you be on a Medicare Advantage plan than anything else. This is kind of a nice alternative if you're not going to be picking up a Medicare supplement plan to pay the 20% that Medicare doesn't pay. If you don't want to pay your prescription coverage, which is a separate premium. When you go with the Medicare supplement route, you're basically paying 3 to 4 premiums depending on what package you get. You're paying your Medicare Part B premium. You're paying your Medicare supplement premium. You're paying your Part D prescription drug plan premium. And if you want dental coverage and extra perks like that, there's a 4th premium right there. Whereas Medicare Advantage, it works a little differently. So here are the pros of Medicare Advantage. You have extra benefits. It's very common nowadays, and some plans come with more than others, but Medicare Advantage plans can come with extra benefits such as dental coverage, vision coverage, hearing coverage. They come with your prescription coverage in most cases. Most of them do. And so you don't have to purchase the prescription plan separately like you do when you go the route of the Medicare supplement. They also come with typically Silver Sneakers or Renew Active or Silver and Fit, which is basically like a gym membership program where they will pay for gym memberships for you. Very few Medicare supplement companies offer that benefit. They also typically can come with benefits like transportation, over-the-counter essentials like aspirin, ibuprofen, fish oil, Band-Aids, vitamins, the works, and they come with all these extra benefits all included, which is cool. They're all in one plan. So you have one card for everything. You still have to keep your Medicare card. You still have to pay the Medicare Part B premium. But in a lot of cases, and one thing we forgot to put on here is the premiums for Medicare Advantage are very low. In fact, in most markets, there are plans available that have no premium whatsoever, $0 premium, because they get all this funding from the government. And so because of that, you could be in a situation where you could have, $144 premium for your Medicare Part B, and essentially that's it. And that's the only thing that you could potentially be paying. Some Medicare Advantage plans do have premiums like $20 a month, $30 a month, and so on and so forth. But typically they're very low premium, and most markets, I'd say probably 80% or more, if I had to take an educated guess, have $0 premium Medicare Advantage plans available to them. So they're very low cost, very low premium, all in one plan altogether. And I think it's less confusing for most people because you have one card that does everything. One card for your dental, one card for your vision, one card for your prescriptions, one card for your medical, and so on and so forth. Now, what are the cons with Medicare Advantage? Because both sides of the coin have their strengths and weaknesses. The cons is Medicare Advantage plans is not full coverage like it would be with Medicare and a Medicare supplement. Of course, it's less expensive, so you kind of get what you pay for. The medical coverage is much better and superior to what Medicare would be on its own. They typically, instead of you paying 20% of medical bills, they lower it down to copays. And depending on where you live, it could be, copays such as $5 to $10 for a primary care doctor, $30 to $40 for a specialist, $200 to $300 a day in the hospital for the first 4 or 5 days, and then they pay everything after that. Whereas with original Medicare, if that's all you had, you would have 20% coinsurance, but not with Medicare Advantage. But it does come with copays. It does have max out-of-pockets as well, so there could be more out-of-pocket opposed to having Medicare with a supplement. They change every year, something you have to keep up on. That's kind of a negative. They come with networks and restrictions. Networks meaning networks of hospitals and doctors. They require that you stay in network. And some Medicare Advantage plans can come with quite a few restrictions in the form of pre-authorization for surgeries, referrals to see a specialist. Now, not all plans have that, but some do. Medicare Advantage, as you can see, has become much more attractive, and because the benefits have been getting better over the years, this has caused them to be much more popular. So this graph shows you the Medicare Advantage enrollments in the millions since 2010. So as you can see, in 2010, they had a little bit over 11 million Medicare Advantage enrollees in the country. Nearly a decade later, in 2019, it's probably more as we speak about this in 2020, but in 2019, they now have 22.6 million Medicare Advantage enrollees. So you can see that number has always been ticking up as it's become more popular and they've added more benefits into the programs. Our states, if you'd like to work with my company on a Medicare Advantage plan, we work with all of the biggest insurance companies in the industry. Our states that we are licensed to do business with you in are Utah, Idaho, Colorado, Washington, California, Texas, Oregon, Virginia, and Florida. That's me, Christian Brindle, Medicare Health Plan Expert and Specialist. Call today. Our office number is 801-255-5340, 801-255-5340. Thanks for watching, folks.